Our Lotus Rapid Recovery and Rehabilitation program makes us different than other organizations because when our residents admit to us, they're assigned a Lotus Care Coordinator that oversees their care from admission to discharge, and we focus on good patient outcomes. The Lotus Care team can specialize in a variety of clinical complexities. We set our nurses up for success by giving them the training, the resources, and the education they need to care for falls with major injury, post-operative care, post-stroke, cardiac disease, respiratory illnesses, complex wound care needs, and infections. A universal goal of any resident that admits to us on our Lotus Rapid Recovery and Rehabilitation program is to recover quickly and get back to their full independence that they had prior to coming to us. And we do that through this Lotus Triad that we've created. The Lotus Triad is the Lotus Care Nursing Team at the building, Aegis Therapy Team, and Theoria's medical providers.
It was very clear to me that not only would Tutera be a great partner for Theoria, but Theoria would be a great partner for Tutera. The partnership just made sense because we both put resident and patient care at the center of everything we do.
We created this Lotus Triad because when it comes to caring for a resident, it's not just caring about the illness or disease they may face, it's about treating the resident as a whole, holistically, and that takes a multidisciplinary approach. The role that technology plays is improving the care that we give to our residents, and we do that through telemedicine. We have telemedicine machines in our buildings, and what that does is it provides healthcare through technology. So if a resident has a change in condition, we can get them face-to-face virtually with their doctor or nurse practitioner.
The Theoria telemedicine is delivered by Theoria providers, and those Theoria providers are full-time telemedicine or virtual rounding providers. So they're not on call for that night. They didn't work a day shift where then they're working at night as well. Those providers are trained as telemedicine or virtual rounding providers. They work as virtual rounding providers, and that is their sole purpose in the Theoria model.
Remote patient monitoring is installing a small device in a resident's room, and it collects their respiratory rate and their pulse rate, and through time creates a baseline set of vitals. And there's nurses watching these vitals come in every day, and if there's a small deviation in a resident's baseline vitals, they call our nurses and alert them to this, because even a small change in a resident's respiratory rate or pulse rate is indicative of a change of condition. This helps us reduce hospitalizations and take care of our residents in our building versus sending them to the hospital.
It also gives you early indications of certain disease processes, and also gives you the ability, or the provider the ability, to know if a treatment is going well or not going well once they've initiated that treatment. So then coupling that with telemedicine and also the presence of providers physically, you have a 24/7 model where patients and residents are being monitored continuously for improvement in their care and to ensure that they receive the best level of care. So the CCM program, or Chronic Care Management Program, is a program that, to me, is one of the most important programs in post-acute care today. The reason being is because the Chronic Care Management Program sets time aside for a provider or for a virtual team to review patient charts, to review chronic diagnoses, and to really dig into each of the chronic diagnoses that a patient or resident may have that a provider that's seeing them for an acute visit or for an acute issue may not be reviewing or may not have time to look at it during that specific encounter.
Some common fears that a Lotus guest may have to overcome is this fear of once you come to our community that you'll be there forever. And I think there's a lot of fear of unknown. But through our Lotus Care program, we provide that care, that multidisciplinary approach to make you feel comfortable and make your stay unique and special. Unite is a philosophy that we live by here at Tutera. And for our residents, Unite means individualization of care. And as a resident, you tell us how you want your day guided and how we can care for you. Because through Unite, you guide your care and how we support you. And Lotus is about short-term rehab and improving your health needs so you can get back home independently